Hey, Dustin here from Red Tree Performance Academy. This video here is specific to our friends on HRT. I have a few students who are on HRT, and I was feeling a little inept as a vocal coach, as I wasn't 100% sure on how some things were changing physiologically within your bodies. I made sure that I did my research and spoke to professionals in the field, as well as my students who were on HRT, to find out as much information as I possibly could. I'd like to thank my dear friend Lucia Crespo, who is a speech and language pathologist here in Hamilton, for her willingness in helping me grow as a vocal coach. I also want to thank my students who are on HRT for being so understanding and patient, and being teachers themselves. I want to thank them for learning alongside with me and always having a great sense of humor. Now, on to the good stuff. Have you ever wondered if testosterone affects the hearing? Well, I have, and the answer is yes. Sex hormones like estrogen can actually have positive effects on auditory processing. However, combinations of estrogen, progesterone, and testosterone can have negative effects on hearing abilities, particularly in aging individuals. So it's really important to keep an eye on your hearing health, especially as you grow older. If you notice any changes in your hearing, be sure to talk to your healthcare professional. They can help determine the cause, as well as recommend the appropriate treatment. But what about the impact of testosterone on the singing voice? Well, when transmasculine individuals undergo HRT with testosterone, they often experience a significant change in their voice. The hormone leads to vocal masculinization, which involves the thickening and the lengthening of the vocal cords, resulting in a deeper, more traditionally masculine voice. However, taking a low dose of testosterone can help preserve your singing voice compared to a full dose. It's important to also note that individual factors such as genetics and the duration of hormone replacement therapy, HRT, still influence the effects of testosterone on the voice. While a lower dose might be less impactful, more is needed to guarantee a complete preservation of the original voice. Vocal training and vocal therapy can still be valuable in adapting to any changes. If you are taking testosterone as part of your HRT journey and want to preserve your singing voice, consider working with a vocal coach or a speech and language pathologist. They can help you adjust to your new vocal range, develop new singing techniques, and maintain your vocal health. So, we've talked about testosterone. Now, I'd like to talk a little bit about estrogen. Does estrogen affect singing? While estrogen levels can affect the voice, particularly in individuals undergoing gender-affirming transition, as estrogen levels decrease, laryngeal tissues absorb more water, leading to mucosal edema, vascular congestion, and increased vocal fold mass. This can result in a loss of high notes, vocal instability, fatigue, uncertainty of pitch, decreased vocal efficiency, and reduced vocal power. For those who are transfeminine and take estrogen, this hormone primarily affects secondary sexual characteristics, such as breast development and fat distribution. Unlike testosterone, estrogen does not have a significant effect on the voice, meaning that there are generally no significant changes to the vocal range. Remember, it is important to do your research and consult with healthcare professionals to ensure you are making informed decisions about your vocal health. Stay healthy and take care of your hearing and singing voice. Getting a little bit more in depth here, there is always gender-affirming voice therapy and surgery. Gender-affirming voice therapy and surgery are available to help individuals achieve their desired voice goals. The result of these treatments depend on the specific therapies and surgical procedures used, as well as the amount of time and effort put into voice therapy. Voice changes. They're going to take time and commitment, okay? Voice changes resulting from gender-affirming transition can take time and require commitment to achieve. It's important to be patient with the process and yourself and allow time for changes to occur. Talking to trusted individuals about your experiences and feelings can also be very, very helpful. Working with a speech and language pathologist can be beneficial in meeting your voice goals. They can provide personalized guidance and support throughout the process. Regular vocal exercises, proper hydration, rest, and avoiding smoking and excessive alcohol consumption will also help. Remember, finding a voice that feels true to you is an individual process, and it's important to be patient and committed to achieving your goals. I'd love to meet you, and I'd love to help you reach those goals. Talk to you soon.